Welcome to the Phoenix PCN Diabetes Basic Education video. We are the primary care network supporting patients registered with Conway, Kingsway, Birmingham, Malsyard, Neville and Pastures Way surgeries. This is a short educational video covering the basics of diabetes and diabetes management, created in conjunction with our team at Phoenix PCN Luton. We will be covering your first steps to change, diabetes fundamentals, risk factors, complications and symptoms, hyperglycemia and hypoglycemia, how to manage diabetes well as diabetes remission. You may have heard of the story about a man who had a very serious accident which left him with severe brain damage. This is a story often used in motivational and inspirational talks due to the magnitude of what this patient overcame, and to highlight the power and resilience of human beings. In fact, the accident was so serious that this man was left with only one hemisphere of his brain functioning. The doctors predicted that this man would never learn to walk or talk again. And yet, bit by bit, he managed to relearn how to walk and he relearned how to talk with just one hemisphere of his brain operating. And we see these kinds of amazing stories of perseverance and the incredible power of mind over matter all the time. What can you not achieve if you put your mind to it? You may remember seeing this young man pictured in the slides at the last World Cup opening ceremony. He refused to come in on a wheelchair. He was the official ambassador of the World Cup 2022 in Qatar, Ghanem Al Mufta. This amazing, truly inspirational character was born with a rare genetic condition, which means he has only half of his body. His parents were told that the fetus was unviable and told it would be better to abort him, that he could not survive with such a condition. And yet, defying all odds, he has scaled the Jabal al-Shams in Oman, one of the Gulf's tallest mountains. See him pictured with Morgan Freeman on the top right at the World Cup 2022 opening ceremony, as well as a picture of him scaling the mountain. And to bring the reality of his achievement home to you, I've added a picture of the mountain he climbed successfully too. Now, before we jump into the topic, I want you to think about how responsible you are for your health today. What choices did you have to take to get diabetes? If you had the choice now, would you choose to have diabetes or be diabetes free? And what's stopping you from making a different choice now? We all know that if you continue to do what you have always done, you will remain in the same situation. Therefore, if you want to get something different, you have to do something different. So, what will you do differently? So, what is diabetes? Diabetes is a long-term condition that causes high blood sugar levels. There are two types: diabetes type 1, where the body does not produce insulin, often referred to as insulin-dependent diabetes, and diabetes type 2, where the body does not react properly to insulin, i.e. insulin resistance, or the body does not produce enough insulin. Symptoms include polyuria, which is going to the toilet often, polydipsia, feeling thirsty often, weight loss or gain, fatigue, numbness in the hands and feet, cuts and bruises that are slow to heal. Patients are usually managed by diet or physical activity or oral medication and insulin. Some of the criteria that would make you more at risk of getting diabetes is if there is a family history of diabetes, or if there is obesity or overweightness, being physically inactive, poor dietary intake, history of gestational diabetes, age above 40, or if you're of the Asian or African ethnicities, medicine-induced diabetes, as well as high blood pressure. These are the complications which could develop if you do not manage the diabetes well, and the diagram shows all the different parts of the body and how they are affected by diabetes. It can affect different parts of your body and result in cardiovascular disease, or your skin could become more susceptible to infections, cause neuropathy where there's nerve damage in the lower limbs, affect your kidneys, can lead to kidney disease, affect your eyes, leading to blindness, erectile dysfunction, infections, especially urinary tract infections, and raises the risk of mental health like depression and anxiety. Let's talk about hypoglycemia. It means having very low blood sugar levels. On your blood glucose monitor, a reading of under 4 millimole per litre is classed as hypoglycemia. Some of the symptoms you may experience are pictured on the slide. You might feel dizzy or shaky, anxious, sweaty, hungry, have blurry vision or a fast heartbeat, feel weak or tired, have headaches, or feel nervous or upset. Some of the causes of hypoglycemia are missing a meal, not having enough carbohydrates in your meal, over-exercising, taking more insulin than needed, alcohol consumption, being unwell, stress or anxiety. For treatment, you can take 5 glucose or dextrose tablets, 4 jelly babies, 200 milliliters of a sugary drink, or 2 tubes of glucose gel. To prevent your blood sugar levels going down to under 4, you can plan your daily activity and meals in advance, regular testing, avoid skipping meals, and reduce your alcohol intake. Just to test you now, how much orange juice would you need to drink to treat a hypo? If you've chosen option 1, 200 milliliters of fresh orange juice, you would have chosen correctly. Let's move on to hyperglycemia. This is when your sugar levels are above 7 mmol before meals and above 8.5 mmol 2 hours after a meal. Some of the symptoms of hyperglycemia are feeling very thirsty, needing to urinate often, having dry skin, feeling sleepy, having blurry vision, feeling hungry or having slow healing injuries, infections or wounds. The causes can be missed medication, feeling unwell, overtreated hypoglycemia, greater carbohydrate content in meals, and no physical activity. For treatment, you would need to adjust the doses of your medication for diabetes, and for this you'd need to book an appointment for a review with a clinician. To prevent hypoglycemia, you need to monitor your blood glucose levels regularly, take medication, consistent carbohydrate content in meals, have regular exercise, and look after your emotional well-being. Some of the serious risks are that it can lead to diabetic ketoacidosis. Diabetic ketoacidosis is a term used for a diabetic medical emergency, which means when your blood sugar levels are so high that you could go into a coma and even die. So what are the checks you should get done to monitor your diabetes? We keep an eye on our weight by measuring on a weighing scale, and similarly, diabetes needs to be monitored regularly. This is the reason some of you have been given a glucose monitor. But your practice will also ask you to book appointments with their team to check other parameters, to assess your individual case, and to see how you are controlling the condition. In diabetic reviews, your height, weight and BMI are measured. Your bloods are taken to check your HbA1c, cholesterol levels, and to check your kidney function. And you are also asked to submit a urine sample at least annually to assess renal function. This slide shows where your ranges should be for the HbA1c, also called the glycemic index, as well as your millimoles per litre if you monitor your levels at home on your own machines. When you stay in the green, you are managing your diabetes well. When the results are in amber, you need to take note and recognize what has caused the levels to raise and do something to adapt. And of course, being in the red range is dangerous. If you are managing the condition well, then bloods should be tested every 6 months. And if the diabetes is not being managed well, then more frequent testing of bloods needs to happen, i.e. every 3 months. And remember, the timing of using the glucose monitors at home is also important. A little rhyme to help you remember: stay below 9 and you'll be fine. And be sure to keep above 4. This is for after meals only. A couple of other processes to make sure we are monitoring and managing the diabetes well are foot checks and retinal screening. Those of you who have been for a diabetes review will know that your nurses check your feet because, as mentioned before, diabetes can gradually damage the nerves and blood vessels, but specifically in your feet. The clinicians are checking for damage to the nerves and blood vessels in your feet to help avoid serious complications. Diabetes is the main cause of amputations in the UK. You should check your feet daily for any cracks, colour changes, swelling and blisters. Some of the signs and symptoms are tingling or the feeling of pins and needles in the feet, burning sensations, especially at night, cramps while resting, slow healing wounds, and patients are at higher risk of complications, particularly when they smoke or have a longer history of diabetes, have poor control for a long time, or patients with kidney damage. What you can do at home to help is wash your feet daily, dry well, especially between the toes, feel for bumps or temperature changes, look between the toes, check each toenail, file your toenails straight across, check for dry, cracked skin, examine the bottom of your feet and track what you find. Retinopathy means damage to the retina. You should report any sudden changes to your vision. In the early stages, you may not have any symptoms and it can become advanced before you start noticing symptoms. Having your annual retinal screening is not the same as seeing your optician for your regular eye tests. The damage would be to the blood vessels at the back of the retina, and this is what the retinopathy screening appointment is checking for. Patients will be at higher risk where there is a long history of diabetes or whether there's a poor control, if they are overweight, if they are smokers, or if they have high blood pressure. We have talked about monitoring and how important it is with your management of the diabetes. Just like you would use weighing scales to measure your weight at home, reviews at the practice with your urine tests, blood checks, along with foot checks, help you and your health professionals see where you are with the diabetes. But why not then take it a step further? You are where you are now because of consistent choices you have made in the past. Where could you be, and what would happen if you made different, consistent choices now? One of the things you can do to improve the condition is physical activity. It's easy if you start gradually and slowly build up. Make a decision to begin now and minimize your sedentary time. Aim to be consistent. When you exercise 20 to 30 minutes 5 times a week, you will notice improvements. But keep some jelly beans at hand to avoid or treat low glucose levels. You can also decide to change what and how you eat. Consistent, healthy choices with a balanced nutritional plate will start to change your results. Remember, the key word is consistent here. You didn't catch diabetes overnight, and there are no quick fixes. The power lies in consistency. We live in a strange world where we want overnight fixes and instant solutions, but set yourself realistic targets. Reducing portion sizes and having half a plate of non-starchy vegetables, as in the picture here, are the small changes you can commit to today, aren't they? This slide just shows the kinds of foods to avoid, and just in case you didn't know, that's the ones on the left-hand side. You want to be replacing them with more slow-releasing foods displayed on the right-hand side. Food is a significant factor and accounts for the majority of impact on weight loss and on weight gain. Changing eating habits can not only impact your weight loss, but consistent, correct lifestyle choices can keep you in the green range. If you can achieve weight loss, what else can you achieve? A small success can have a knock-on effect on lots of other areas in your life. To prevent complications of diabetes and improve the condition, keep control of the blood glucose, cholesterol, and blood pressure. Improve your health by making healthy choices and being physically active. Include foods containing carbohydrates from whole grains, fruits, vegetables, and salads. Stay steady and consistent with carbohydrate intake. Limit your alcohol consumption to 1 to 2 units daily. Getting restful sleep and looking after your mental well-being can also improve your condition. There is a diabetes remission program, which is a total meal replacement treatment that is available to anyone who is 18 to 65 and has a diagnosis of diabetes type 2, where the BMI is over 27, or the BMI is over 25 with a Black or Asian ethnic background. However, if you don't meet the criteria, that doesn't stop you from taking action today to make some changes, like the ones that we've already mentioned. So you've seen how by simply attending your appointments, taking your medication, being responsible for educating yourself and making your health a priority, and taking consistent actions are all your first steps to change. You've heard the famous quote on our starting slides by Chinese philosopher Lao Tzu. A journey of 1,000 miles begins with a single step. Take that step today. The choices you have made previously have led to this condition, and so this shows you how your choices are impactful. When you choose to take responsibility and action, when you choose to make your health and management of the condition a priority, that is the first step to change. Taking these small actions, making these different choices and consistent steps can achieve better outcomes for you and could help you be diabetes free. Here is some information that could help you on your path to change today. Please take a screenshot or refer back to the video later if needed. This educational video was compiled to raise basic awareness of a condition that has a high prevalence in Luton. We recognise that there will always be exceptions to the rule. Please contact your practice if you need more support managing the diabetes or if you need support with medication dose adjustment. We at Phoenix hope you have benefited from this video. Thank you very much for your time.